thing, crucial thing. If you are not accepting someone as a human being, then you cannot give the service properly. That's a major thing I want to say.
Absolutely, absolutely. You very correctly said that yes, and it is not only to give the service, but it is also to make awareness and make that feeling comfortable. Probably that's we human being are. So that is the thing. Yeah. So I think after that, just I because probably we also don't know about what the government is doing. And you told Amrita ji ki government is actually doing a lot of things for the marginalized group. So what the government is doing?
Okay, so let come one by one. If I talk about HIV per se, definitely I was telling you about the HIV/AIDS Act, and also like you must be knowing in our country, HIV treatment, testing, everything is given free of cost. That is given all the government hospital. So but the ART center, and there is also so many other project. If you know about this national AIDS control program, there are Shampurna Suraksa clinics. So there are different programs actually dedicated or supported by the government itself. And in our country we can get the ART drug free. Now, there is one or two suggestions, because I am also associated with UNAIDS Program Coordinating Board. Now, there are a couple of countries in African region. They have, they have tried this rollout of this one long-acting antiretroviral. So that is also another area. I think government is already considering this, and maybe in coming 1 or 2 years we can see also rollout of LARV in our countries as well. So, and there are so many organizations also that are supported by TIs. Now TIs mean targeted intervention. So we have HIV/AIDS targeted intervention program that can be done by community-led organization or CSOs, NGOs for typically these marginalized groups. So there are TIs for the transgender people, there are TIs for sex worker, there are composite TI. So throughout our country, there are so many targeted intervention program, and through these TTIs, actually, people can get testing, treatment, everything at absolutely free of course. That is one part, and then if I talk about the other specific healthcare for the transgender community, I mean, if I talk about, I was giving you information about this Delhi AIMS. Now there are other aims also, and at Alliance India we are also giving awareness sessions to different aims in different states. That Delhi aims have already started. Maybe you also consider to start at y- your state. That is one part. And definitely like if I talk about sex workers, earlier in our country, being in sex work was also similar, like almost like it's penalized. I mean, as being a sex worker was not legally authorized. Supreme Court has also changed that sex work is also a profession now. The other thing we are struggling with now for the people who use drugs, that is only one punitive law still there in our country, and I know definitely this will also be worked on. So in short, I mean, people who are infected or affected by HIV, if I talk about LGBTIQ people, if I talk about people living with HIV, sex worker, whoever, there are many targeted intervention program, government program, dedicated program, and there are so many other services also given by the so many CSOs are there. They are also working on that. Like Alliance India, there are so many other organizations. They are also, uh, supported or closely working with the government. For example, I can well recall, yes, that the National AIDS Control Program Phase 4, the transgender specific, I mean, transgender intervention program TI, that introduced in National AIDS Control Program Phase 4, in NSP 4, and I was also there in the working group. So there also we identified like why transgender people should be given special care, because they have so many other things, other challenges as well. So that is another part. Definitely, I will like to talk about that. Government has different working groups. In NACO also there are different like technical working groups. I'm also associated with NACO for the transgender technical working group. So I mean they are constantly trying to help us that what are the problem challenges, all these things, what else that can be done. But yes, definitely, if I talk about HIV, it's absolutely, testing treatment, everything is free in our country. And now also there are community support center. Even those are now being taken care by the government of India, where they can be given some kind of like short-term care or specific care for the people living with HIV and other marginalized groups. So this is a very basic or a very rough picture. One thing definitely we must have to also, I definitely should address this. As you know, that because of the funding cuts by United States, there are so many donors who are now able to not being able to help us, right? So this is also bringing very critical side effect of the community work, the engagement, intervention, everything. So now I think definitely we should also think about public-private partnership. We have to think about how we can get involved more CSR opportunities. There are so many private entities also, if they can also come in the picture and they can think about the okay, public and private entities, they can work together. I think now we have to explore. Yes, there are things are going on, but these things has to be scaled up. Yeah.
It's wonderful. And actually, a government is doing a lot of things. And I think when the government is doing, we as a society should also do for these groups. And they equally deserve all the respect in all forms, in a forms of giving healthcare, in a forms of giving treatment, in a forms of giving the counseling. So thank you. It's been wonderful discussion, and I think it's a ever-ending discussion. But yes, the time is always short, and definitely goodbye is not the goodbye, but it's actually the beginning of something hello. So, Amrita ji, it's really I think this podcast is an eye opener for me also, and definitely for our viewers also, that how important and these marginalized groups have all the rights to have. We don't need to, be kind to them, and don't give, at least think about that they are also human being, and give those respects and rights what they actually deserve. I think that is the main thing, main nichore or the take home message from this podcast.
Absolutely.
So thank you so much, Amrita ji, and thank you so much for joining even after in your busy schedule, and even after traveling for almost 40 hours in flight. You are still there in this with your choked, yeah, the Thor, yeah, with sore throat. You are still there. Thank you, thank you, thank you so much.
Thank you
And
so much. God
thank you.
bless you all. Thank you so much.
Absolutely. Thank you so much. And absolutely, this all podcast is the brainchild of our dynamic Foxy president, Dr. Sunita Tandulwadkar, madam. And it's really, really, really thank you so much, ma'am, for always giving us all the supports, and definitely our technical team and all, because this is my last podcast for today. For actually not for today, but for this is my last podcast under tenure of Dr. Sunita Madam. So I really thanks to all, the Vinod ji, the Kripa, the Pradeep ji, all the technical team for always being with us whenever I want live or whenever I want recording. You all are there. So thank you, thank you, thank you to all of you, and definitely we will catch. And thank you so much, Amrita ji. Definitely we will catch you physically as well as virtually in the near future. Thank you so much for all
Thank you
the
so
love,
much.
for all the affection.
Thank you.
Thank you
All
so
the
much.
best for your good work. Thank you.
Thank you.
Bye.
Pradeep, please stop the recording.